The sacrum. The sacrum will be presented in the practical exam also. We are not interested either this is a male or a female. We will not ask you about this. But you know, as you know, the sacrum is 5 sacral pieces which unite together to form this triangular sacrum. If I mark this area and name the structure related to it, it is the 5th lumbar vertebra and the intervertebral disc between them. So this is the body of the first sacral vertebrae. If I mark it, identify the structure, you may say this is the first sacral vertebrae. Name structure related to it, intervertebral disc, or the 5th lumbar vertebrae. The most important is this area, which can be marked clearly. This is the promontory of the sacrum, which is important clinically also, so it is marked in the practical exam. And this area can be marked also like figure 3. This is for the attachment of the piriformis muscle. Can be marked also in the practical exam. If we mark this area as a line, name the structure related to it is the median sacral artery. Median sacral artery. If we look to the side of this, you will find here an auricular surface. It can be marked in the practical exam. Name the structure related to it is the sacroiliac joint or the articular surface of the iliac bone. So this can be marked also in the practical exam. We can put something here and say identify the structure. This is the sacral canal. On the same time, at the posterior surface here, we can put another thing here. Identify the pointed structure. This is the sacral hiatus. Sometimes we will put things in this is the anterior sacral foramina, where the anterior sacral nerves and vessels emerge. So if I put here, identify structure, anterior sacral foramen. Name the structures passing through it, anterior sacral nerve, anterior sacral vessels, and no more. Sometimes we will put here and name the structure passing through it. Passing through it is the filum terminal, is the coccygeal nerves, which are passing through this, and the 5th sacral nerve, 5th sacral nerve. We are not interested in putting marks for muscles at all, but the importance here is for this area, as we mentioned. The joint is important. The piriformis muscle is important. The promontory of the sacrum is important. The median sacral artery relation here. This is the ala of the sacrum. We do not usually put something here. But the most important thing is the lumbosacral trunk crosses this on both sides. But we usually do not. This is the sacral canal, and this is the sacral hiatus. This is the most important things by far in the sacrum. If we look to the pelvis, we can find an articulated pelvis, or we can find the hip bone. If this is the hip bone, what's important for us in this area for the hip bone? Number one, this is the pubic bone. This is the body of the pubic, the superior pubic ramus, inferior pubic ramus. And this is the body of the pubic articulate with the other body of the pubic bone, form the symphysis pubis. I can mark it and say, name structure related to the colored area, symphysis pubis. Concerning this superior, and this is the arcuate line. This is the arcuate line, which form part of the pelvic brim or the inlet of the pelvis. So I can mark it. because the inlet of the pelvis is important. So you can find it as marked here for the arcuate line. The arcuate line. Concerning other things, from the inner surface here, this is the obturator foramen, and this is the obturator canal. I can mark the obturator canal and say, name, identify the structures pointed at or color the area to obturator canal, or name the structures related to the colored area, the obturator nerve and the obturator vessels. It can be marked also. It's also, this is the obturator foramen, is covered in living by obturator membrane. From this membrane and from the adjoining area here like that, you'll find this all things is colored. And we'll put the paper here to cover this area. And all these things is colored. This is the origin of the obturator internus muscle. Origin of the obturator internus muscle. The ischial spine also is important in this area. It's important to know. This is the ischial spine, and the structure attached the sacrospinous ligament. Sacrospinous ligament. So we have to know it also, this area. This is the ischial tuberosity, and from the medial side here you will find a groove above the ischial tuberosity immediately. This groove can be marked in the practical exam. This is the pudendal canal. The pudendal canal lies here, where it transmits the pudendal nerve, the main nerve supply for the perineum. All the perineum are supplied by the pudendal nerve. So we can mark the pudendal canal at here. Also, the auricular surface of the iliac bone can be marked in the practical exam, because it is related to the auricular surface of the sacrum to form the sacroiliac joint. So if I mark it, I say either auricular, name the structure related to it. Either I will say auricular surface of the sacrum or a sacroiliac joint. And this is the iliac tuberosity. This tuberosity is an important area because the attachment of the posterior sacroiliac ligament, which is a very strong ligament. So iliac tuberosity can be marked in the practical exam, and then the structure that attached to it. This is for difficult cases. And this is the attachment for the posterior sacroiliac ligament, which is a very strong ligament. This is the ischial tuberosity here. And the importance of ischial tuberosity here is the attachment of the sacrotuberous ligament only. So if I mark it, name structure attached to it, I mean the sacrotuberous ligament. I don't mean muscles or something because you haven't studied it. This is by far the commonest areas in the iliac bone. We are not interested in the rest of the hip bone because it's out of our study. If we look to this articulated area, this is the sacrum, I can mark this area. This is the sacroiliac joint. I can mark also the promontory of the sacrum. I can mark the anterior sacral foramina, structure passing through it. This is the ala of the sacrum. And this is the symphysis pubis. And this is the arcuate line, which form the inlet of the pelvis. And this is the symphysis pubis, superior pubic ramus, inferior pubic ramus. And this is the ischial spine. I can mark it also. And this joint also is important, sacrococcygeal joint, because this is a very mobile joint. And this is the coccyx. Here is the ala of the sacrum. Sometimes we do some tricks and we make a line here I'll color it and say this is area of the sacrum. Name structure, one structure related to it. If this question happens, so lumbosacral trunk comes here to share into the sacral plexus. From the inner surface, the origin of the obturator internus is important also, and also the obturator canal and what transmits the obturator canal. And from inside here, this is the ischial tuberosity. Above it, there is also another canal, which is the pudendal canal, that transmits the pudendal nerve, the main nerve supply, to the perineum. And this is the coccyx. And this is the sacral hiatus, as we mentioned. And this is the posterior sacral foramina, which transmits the posterior sacral nerve and vessel. And this is the sacral canal, which transmits the dura, the arachnoid, and filum terminal, and lower lumbar nerves, and coccygeal nerves also through it. This is the sacral canal. We're not interested in inserting for the insertion of some muscles of it or not, inserted or not. This is the main things which we are interested in. Origin of the piriformis muscle. From the middle three pieces of the sacrum, sacroiliac joint, symphysis pubis, promontory of the sacrum, ala of the sacrum, symphysis pubis, arcuate line. This is by far the commonest area. Thank you very much.